Michelle grew up in home health.
I did grow up in home health. I came to hospice and home health because my grandfather was on hospice services, and I was helping take care of him in the home. And the hospice team were in taking care of my grandfather, and I was looking at going to nursing school eventually, and they said, "You should come work for us as an aide because you're doing this," and so that's kind of how I got into working in home health and hospice, and just learned to love it as an aide, and got to I became an LPN and worked for Doty. I have to tease and tell, I remember as I got out of school as an LPN, of course, loved working in home care and hospice, and I remember Doty saying to me, "Well, Michelle, you need to go get some experience now." After a couple of years, called Doty again and said, "Hey, I'd love to come back as an LPN," and then as I came back and worked with, I didn't even ask the next time. I was just, after I graduated from RN school, then I said, I'm going to go to the hospital and get some experience. and so I've had the opportunity to kind of work my way up in our department. And so me and Marcia got to kind of work together as we have, as the program grown. We always had Rapid City Home Health and Hospice, and the Northern Hills had their own hospice program, but we were able to merge our programs together in 2016? Yeah, 2016. And so, which really helped us, I think, do better, with being able to standardize practices across the hills, because we take care of patients not only in the Northern Hills but in the Southern Hills. Really gave us an opportunity to kind of grow and to have more resources, just because we were backup for each other. If census went down in one area, we could pull from the other, and really just make things stronger. As far as our volunteer coordination for our hospice program, our social workers, and we were just able to enhance those services. Now we are up to 140 employees, so we continue to grow. Our census is now, through both areas, we have about 450 patients on services. And so our caregivers are traveling to see patients all over the Black Hills. We encourage our caregivers to start from home and to end at home. And so they are using technology to really help better serve and to be able to provide better care to those patients. It is nice now that we are in a system where we can actually have, at our fingertips out in the homes, their records from their office visits and their x-rays and their blood work and all of that. So it really does just make a better, much more data and information out there when you are taking care of patients in the home, because it definitely has changed in the sense of, even our patients are, I feel like patients are just much more complex these days, getting out of the hospitals quicker, and so, it definitely makes it challenging for staff in the field. Probably as home health and hospice, I would say is one of the tougher parts of it is the staffing for, finding the right fit for people that are nowadays ready and willing to go out and take care of patients out in the home. But our technology and interdisciplinary team really do a great job. Yeah, it was just a great opportunity to learn and grow, and so I was very appreciative of your mentorship and both of you. I felt very lucky to
I really believed in Michelle. In fact, I think I was able to nominate you for a scholarship through our Home Health Association when you were working on getting your bachelor's degree. And so we're very proud of your dedication and that you came back to us. And so she was homegrown in hospice and home health.